Okay. Okay. Good evening, everyone. How you doing today? This is Deborah Jones, your Blue Table Talk and host. And so I'm so glad that we're on tonight. We have a special guest tonight, and this is part two of our mental health. You know, we already had the part one a month ago, really, December. And so I thought I'd bring on part two of it. So before we introduce our guest tonight, let me do a little housekeeping on COVID. So as we all know that we can take the COVID testing at Beaumont Urgent Care at 3650 North Major Drive here in Beaumont, Texas, Suite A. Phone number is 409-333-1272. And they're only taking like 75 patients per day. So you need to call if you wait late, you probably have to call them before you go in. And I think they're taking all insurance. So just go down there and see. If not, call and make an appointment. And it is a rapid test. So you get your results back in 15 to 20 minutes. So if they're taking the day, then you know you can take it tomorrow, whatever. So another place you could take it is MD Kids, 490 I-10 North Frontage Road. You have to call to make an appointment over there. So either call them and their number is, and if you're doing your GPS, make sure you put in North Frontage Road, because if you put in Frontage Road, then you'll be going somewhere else. They'll take your GPS will take you somewhere else. So put in North Frontage Road, and then after that, the phone number is 409-212-9988. So don't forget to take your COVID test. Go take your COVID testing, and like I said, it is rapid. It takes 15 minutes before you get it. And today, I took the COVID vaccine. It says something as, I'm doing my part to save lives, maybe my own vaccine, COVID-19, the vaccination. So I took it today. And the way you can take it is you have to make an appointment, and you go to www.Walgreens. And I'm running across the screen, Walgreens.com//find care vaccination /COVID-19. So you have to go online to make an appointment, and they're only doing 65 years and older with underlying illness, and also 16 years and older with underlying issues. So you just can't just pop up and take it if you don't have an underlying illness. And so, and you need to go and take the vaccine if you want to. Now that is your choice, and it is 2 parts. So my next part would be February 9th. So like I said, I took it today, and it was pretty good. It didn't hurt or anything like that. So I'm giving like a little heads up so you can do it. Also, tonight in Beaumont, we have 129 cases, 121 cases. We had 1 death tonight, and so I think that I had underlying illness. So let's keep everybody in prayer and do what we need to do to keep ourselves safe from COVID-19. Okay, so that Walgreens place, they only do it on Fridays and Saturdays. And you can go to Walgreens, and this is Orange, Bridge City, and Vidor. So it's number 12355 in Bridge City, number 3081 in Orange, and number 10139 in Vidor. Those are store numbers. So you do your best to get yourself together, and they'll do the rest for you. Okay, excuse me. Okay, so let me introduce our guest speaker tonight. We have with us Miss LaShonda Martin. LaShonda. I'm gonna read LaShonda's bio for you. She's so shy, y'all. I'm gonna read her bio. LaShonda Martin is a licensed professional counselor that works at Northside Behavioral Health Services in Atlanta, Georgia. As a mental health clinician, 3. LaShonda has over 15 years of mental health experience and has been with Northside's outpatient clinic for over 8 years. As a graduate of Clark Atlanta University and Georgia School of Professional Psychology, LaShonda is trained in clinical psychology. LaShonda's experience ranges from children to adults with a broad range of mental health diagnoses, including co-occurring or disorders. LaShonda believes that everyone can benefit from mental health therapy as everyone needs a healthy outlet to express themselves. Her motto is, as long as you're on this side of life, you will have an opportunity to become the best version of yourself. And that's true. I like that, LaShonda. Thank you. So we have tonight LaShonda Martin. Hello, LaShonda. Tell the guests hello.
Hello, everyone.
She's from, like I said, she's from Atlanta, Georgia. And so I like to pick nothing but the best for our listening audience. And so tonight we're going to ask you a couple of questions, LaShonda, about mental health, because with everything that's going on, we have the pandemic, we have the election, we have our president is out with riots and everything. You know, people are hurt by this, and you know they go into this mental stage. So we're going to talk about one by one. So let's talk about the pandemic, since I mentioned that one first. How does the pandemic in general affect our mental health?
Well, I mean, we're all kind of going through this at the same time, right? So it kind of, most people are struggling with some form of anxiety or some level of anxiety around this, considering, not knowing, what's going to happen from moment to moment with the pandemic and with COVID. So a lot of people are struggling with that anxiety, isolation, depression. We're seeing a lot of people have an increase in substance use, a lot of increase in abuse, physical, sexual. So it's definitely affecting us in a lot of different ways. So
Wow. So what do we do with that? I mean, we just don't sit down and say, okay, I need to call a clinician and see why I'm going through this or whatever. Do we just go to our doctor to get medication for it? Or what? What do we do?
well, I do think that everybody, like I said, can benefit from having that outlet of having therapy. But we, as we know, in our community specifically,
Mm-hmm.
a lot of people don't reach out for the support and help that they need. We have people that were perfectly fine before the pandemic happened, and then this kind of catapulted them into depression or into some type of mental health um, situations. So I think that being able to connect and reach out and get the support around this, because we're all in it together, right? But
Right.
being able to connect and reach out and get the support around this, I think that that is one of the things that we can do. I just think of connection and how important that is during this time with everyone being isolated. And it's like, well, how do I connect if everybody is supposed to isolate and quarantine and we
Right.
can't kind of be around each other how we typically would? So a lot of creativity has to happen right now with connection. Like how we're doing now with the video, Zoom is out there. That's something that's free that people can utilize to stay connected with other people. So I think that that's important. I think that being able to kind of take care of yourself and be kind to yourself during this time is important. A lot of people struggle with that already with self-care, but I
Mm-hmm.
think that that's super important right now is finding something that recharges you, that refreshes you and helps you feel good about what's going on. So those are things that are important right now and that people can kind of utilize to help them, you know not necessarily make sense of what's going on, but to find some comfort in life right now.
So I just heard you mention self care. So what do you mean self care? What do you mean by that?
So you know how, okay, we have our cell phones, right?
Mm-hmm.
And we're not gonna go to sleep when that battery is on 3%. We're gonna plug that battery in to
Right.
recharge it, right? So
Right.
think of self-care in that way. Things that we do to refresh and recharge us, things that we like to do that are healthy, that refresh and recharge us. So self-care can look a lot of different ways for different people. Some people find exercise something that recharges them and refreshes them and that they enjoy doing. Some people, they might find activities like maybe board games or spending time with family. It's just anything that helps to refresh and recharge you, I would consider self-care.
Okay.
What makes you feel good?
What makes you feel good?
Yeah,
Great.
healthy things that make you feel good.
Okay, so okay, you say healthy things. Eating.
Well, no. Well, to a certain extent, but not like
I'm, I'm not.
overeat.
I'm not talking about overeating. I'm talking
Mm.
about healthy foods.
Yeah, that's a part of self-care, but those are things that we should be doing anyway, right?
Right, but
We
you know,
should be eating healthy. Well, yeah, because that's another thing. A lot of people are overeating right now and
Right,
emotionally eating.
right. And then we find out that, oh my God, I done gained weight. So now that's another problem. So
Right, exactly.
now we're going to another stage of depression.
Right.
So how do we deal with that? I know you're gonna say push away from the table, but
It's not that easy.
that's easy. I'm gonna say that's easier said than done. So what do we do?
I think you have to connect with how you're feeling. Because a lot of times that's the issue. We're not allowing ourselves to feel. We're not connecting with how we're feeling emotionally. We're so programmed to kind of just go through life. And it's like we're not stopping to just really take that time to check in with ourselves and see how we're feeling. So I think that that's part of it, is being able to check in and acknowledge and kind of put words to how we're feeling, right? Because I think that when we know and we can verbalize how we're feeling, that definitely can kind of help us to kind of get on the right path with that. And then physical activity, right? This is a time where we're not as active. I mean, it's the winter time. I feel like here in Atlanta, the weather is just so unpredictable. But I
Mhm.
think being able to kind of develop a good routine of being physically active, and that can be a lot of different ways. It doesn't have to require going to a gym or, even sometimes going outside. You can do things at home to be physically active, but that's important too, because
Right,
there's a component with physical activity in our mood as well. So
right,
increased physical activity improves our mood, and research backs that up.
right, right, right. Okay, so we just missed this pandemic. We got this pandemic going on, like I said earlier. We got the past election going on. We just witnessed a riot on television in Washington D.C. last week. So how can we deal with all this in our everyday life? Because as a matter of fact, Trump is not out the office yet. And we all know that something else might be trickling in his mind before the inauguration on next week. So how can we deal with this before we just explode?
Well, I think that the biggest thing is, like, we can anticipate all of these things can happen, right? I'm pretty sure a lot of people foresaw what was going to happen before it happened on last Wednesday. But a lot of times we can kind of create this anxiety for ourselves by worrying about what's going to happen, even though I think we need to kind of be realistic, like, okay, these things can't happen. But being able to just kind of stay present and in the moment and focusing on, like, okay, well, what's going on now, and not getting so ahead of ourselves. Now, I'm not saying to not be realistic and know that things can happen. But we sometimes, like I said, can get so far ahead of ourselves that we create this anxiety around things that haven't happened, that might not happen. We just don't know. So I'm a big believer in just trying to be present and stay in the moment, and dealing with kind of what's going on now.
Yeah. And then yeah, we can deal with what's going on now, but then we're gonna still worry. We're gonna, let's be real.
Let's be real.
Yeah, we're gonna still worry about. Okay, so now Trump is in Texas. So what is it? And we know that today in Texas, that the state representatives, they went into their office today. They were sworn into their office. That's what the word I need to say. Sworn into their office. So now they worry about. So what is he gonna do in Texas right now? I got that. As a matter of fact, I got a text like that yesterday. Well, we're gonna see what's gonna happen out here in San Antonio. So
Mhm.
that now that he's going to be here, so now there's another worry on it, and that little bird in the back of your head it's just moving so much. So what I mean, how
I
can
mean, that anxiety is real. And I think most people are experiencing kind of like what's going to happen next. But we have to kind of stop and think, in this moment, what do we have control over? What is it that we have control over?
and we can't control that.
Exactly.
We can't.
Exactly. So, I mean, that's the thing when I kind of talk about being able to just kind of be present and deal with what's going on right now. It's difficult, of course, right? Because
Right,
we're saturated with everything all over the news about what's going on, and we need to be up to date about what's going on and know what's going
right.
on. But there has to be a balance there. And us looking at, okay, well, in this moment, this is what's going on. What do I have control over? These are the things I can control. Let me try to focus my attention on that.
Mhm.
Because, like I said, a lot can happen or it might not happen. We just, with who we have in office, maybe I shouldn't say that. We just don't know what'll happen.
Yeah, we don't know what. But but I always think me as myself, I ride every day. I ride a lot. Just take a ride. And every day, I mean, I watch television all the time. I'm watching the news. I watch MSNBC. I watch CNN. I watch the local news. I watch it all the time, but I don't watch it as so much. I'm glued to the television. You see what I'm saying? So, but I do have family members that are like that. And I always tell them to get away from that TV, get away from the media.
Yes, yes.
Don't keep watching that. But what I do, I have a girlfriend. She'll tell you in a minute. When she'll call me and she'll say, well, what you doing? I say, you know what I'm doing. She'll know exactly what I'm doing at what time. I'm riding. I'm trying to clear my head.
That's good.
Because it's pandemic, because of the election, because of this riot, but we do have to be careful. I do know that we do have to be careful. So in the meantime, I'm still trying to get all this together. So you think I'm doing things right, or because I feel as though I am, or do you think as though I need to turn towards something else?
So you mean as far as the riding?
Right.
Is that part of your self-care?
Is that part of my what?
Is that part of your self-care? Is that how you kind of?
Yes.
Then that's a good thing. If
Right.
That's what you kind of utilize to kind of take a break, refresh, recharge, I think that's a good thing. We all have our ways of coping, right? And if that's what's working for you to refresh and recharge and get away from kind of what's going on, yes, that's definitely a good thing. And I encourage everybody to kind of find something that's for them that will help them to refresh and recharge, because that's what it's about.
Right. Let me see what my audience is saying. One girl said she's all the time riding. Here's one person says, getting adjusted to virtual church and the reality that we are the church and our relationship with God is challenged. We have to really show up as a Christian and lean on Jesus.
Mm-hmm.
We can't leave him out the picture.
Right.
Yeah. So, yeah, you like you were saying, whatever floats our boat, that's what we need to do.
Yeah, we definitely need to take that time, because if you're not taking care of you, it's going to be difficult for you to do the responsibilities or take care of the responsibilities that you need to take care of on a day-to-day basis. Right.
Excuse me, so everybody that's on here tonight, would you do me a favor and hit your share button, because there are a lot of people out there that needs to hear this. This is mental health part 2, and so hit that share. It doesn't cost you a dime. Just move your finger on up on top of your keyboard. Hit share. Okay, so I'm a parent, but I'm not a parent of little children. So I know there are parents out there who have kids that are in school, so they're coping with dealing with their going to work, coming home, because most of the kids are virtual. You have more kids virtually than you have in school. So most kids are virtually with their schooling. So how do a parent cope with a child that while we're going through this pandemic, they're working, they're coming home to work with their children? That's a mental thing, because you working all day long, 8 hours a day. Now I got to go home and work with my child, see that everything's correct. So how do you deal with that?
Well, I mean, and I want to add to that, because not only do you have the parents that are working out of the home, you have the parents that are working in the home while their children are at home doing virtual learning. So there are a lot of different layers and components to that. But I think having the structure is important. And also, I'm going to speak from a little personal experience, having a job that hopefully can help be flexible as far as your schedule and things like that. But that's not always realistic for some people. But I think being able to kind of, once again, have an opportunity for your self-care so that you can be present and available for them. It all goes back to you taking care of you, because that will help you to do what you need to do in taking care of them. So it is a struggle, and it's very, very, very stressful with trying to help them with virtual learning and manage your own work and all of those things. But I think trying to be, as good to yourself and kind to yourself, because all of this is unfamiliar territory for most people, right? I mean, you have some people that were kind of balancing this before, but for most people, all of this is unfamiliar territory.
The 1800s. Oh yeah.
I didn't hear you.
That was in the 1800s.
But it's definitely hard and it's stressful. But I think setting up structure is important, right? Because kids need that structure and they thrive off of structure. So I think being able to have that, setting aside a place that is their place where they do their schoolwork, I think that's important. You having your space, I think that's important. But also being able to take time out and being able to just kind of let them have a break, you have a break, and both of you guys, if possible, engaging in your own self-care. Because I think I know our kids mimic us. So when they see us taking care of ourselves and doing those things, they mimic that too. So I think all of that's important in order for it to work
Right.
with everybody and kind of what's going on in the home environment with working and virtual learning.
Right, right. Don't forget, guys, to share, and don't forget to ask questions. She's here to take your questions. Okay, so I read in your bio that you not only work with adults, you work with children also.
Not now. So for the last 8 years, it's been adults only. But prior to that, my experience was with children.
Okay, so when you did work with the children, how did you feel knowing that a parent is bringing their child in because they think something is wrong with them mentally?
Well, I think that it's good that they're reaching out and they can recognize that they need the help and support around what's going on with their child. I think that's kind of one of the things that I always say when anybody comes into treatment. I think being able to recognize, hey, I need some support. Something is going on that I need some help and some support around. So that's kind of always my first thought, is good, you're here. So let's kind of talk about what's going on.
Right. Do you prescribe medicines, or there's a
No, that would be a psychiatrist. So the clinic that I work at, we have a comprehensive service. So we provide psychiatry services as well as mental health services, as well as counseling or talk therapy rather.
Right, right. Okay, so what positive, since we have the children here, so what positive discipline could a parent use to redirect bad or good behavior?
I think that being able to use positive reinforcement, right? Being able to kind of, we don't have to use treats and rewards and things like that to reinforce things. I think letting our children know, I really like it when you do this, this, and this. I'm really proud of you, or things like that. Being able to use our words, I think that's a good way to reinforce our children.
So now that you're now that COVID is here and the pandemic is here, do you do virtual, or they still come into the office?
No, we only do virtual, which is cool because I think we've been able to reach so many people that couldn't have or were unable to access our services prior to the pandemic. So the virtual has been working really well for most people.
So is it just in the Atlanta area, or you can do this anywhere?
Well, that's kind of a tricky question because they have changed a lot of the guidelines around crossing over into other states because of COVID. So I think we are able to practice if we have clients that are in other states, but pretty much we try to, refer them to places that are in their area.
Okay, so you can't say, okay, well, I'm in the Atlanta area, so you need to go. You need to go this office or somewhere. Prefer them to go somewhere else, or refer them to go somewhere else.
We try to refer them to places like, say, for instance, if I had a client that relocated to New York and wanted to continue to see me, which is fine. However, say you're in a crisis, it's nothing that I can really do to help in that crisis. So it would be more beneficial for you to connect to services in New York where, if something happens, they're there in the area where you're in. So, but we have been practicing, like I said, over state lines because the laws have kind of changed around it. Because typically you're licensed in your state.
Okay, so say I have a child. How can I recognize the stress in my child? That my child is stressed.
Mm-hmm. A lot of times kids present with somatic symptoms. So they might have stomach aches, headaches, like physical things that we can kind of notice that, might be causing, or that might be, I'm sorry, I can't even get my words together. That might be because of the anxiety. So I think that paying attention to that, and then we notice different changes in our kids' behaviors, right? If they're more withdrawn or if they're more to themselves, sometimes if they're clingy. I mean, there are a lot of different things or behaviors that happen that kind of let us know that our child might be a lot more anxious than usual. And when we notice those things, I think it's good to kind of talk to our child about that and, kind of leave the door open to know what's going on with them. Because let's be honest, just as much as the pandemic is impacting us, it's impacting our children too, right?
Mhm.
They're at home, they're not around their friends, they're doing virtual learning, which let me tell you, it's difficult. I'm grown, and being on the computer all day, on the screen all day, seeing clients all day is challenging for me. So I know it's challenging for the young ones having to sit still and focus on the screen all day.
Exactly.
So yeah. So this is affecting them just as much as it's affecting the adults. So I think we have to talk to our kids around this and just kind of create things that can be fun for them in the midst of this. I know one of the things that a lot of kids do, they can get on FaceTime or they can play games online with their classmates. Or, sometimes it just depends on your comfort level. Some people, they do organize play dates with friends, but they're like outdoors where they're socially distanced and, things like that. So I think that's important as much as you can to keep them connected to their normal lifestyle as well.
Right, because I know when it first started with the virtual learning, a lot of children were saying that they want to connect with their friends. They want their friends online with them while they're learning, and so it wasn't like that, you know.
Right.
But I don't know. Then they start opening up the school for the children to come back if they wish, if parents wish for them to come back, or keep them at home first, or whatever. But I guess it's going okay. I don't know. I'm not in the education anymore, So I know I do teach my great nephew, and he's fine, but he's just 5 years old. He doesn't. I mean,
Right.
with him. So I have a lady who says, let me see, what if your child is naturally low key?
Meaning that they're kind of quiet or that.
Yeah, probably that's what she's trying to say. They just don't. Can you notice anything in them because they're low key? They've always been settled. And they're. What do you do with that?
I
I mean,
think we notice changes in our kids' behaviors. We notice changes in the way that they do things. I think we just have to kind of pay attention and not be hyper vigilant, but I think being able to pay attention and just kind of talk to them about it. I feel like that's the biggest thing. Let me tell you, my dad, that's the one thing that he's always done is talk, 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 talk. And he believes in that because he feels like that's how you get information out of your kid, right? Is having an open,
right,
honest conversation and having
right,
them feel comfortable enough. So I think that being able to communicate, you pick up on what's going on with your child.
right, right. I know a lot of people who just love to talk, 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 talk. I'm gonna see you next month because we're talking.
Well, he's a person that likes to dig and kind of know what's going
Right,
on. And maybe that's where I got the therapy part from. I don't know. But I think just having that communication with your child and being observant, a lot of times we pick up on things.
okay, so you told me about the stress. What are some of the signs or symptoms of an older child who's distressed or have a little anxiety? And what are their signs?
They might be more irritable. They also might be withdrawn or clingy. I mean, I think it's kind of maybe some of the same things. Um, I'm trying to think. They Irritability is one of the things that comes to mind when I think of older children too. But they also have somatic symptoms as well. I think anybody can have somatic symptoms when you're talking about anxiety. But it's some of the same things that you would notice in your younger children. I know that for a lot of teens, vaping and marijuana use and things like that, that's increasing during this time too because of, kind of feeling isolated and alone. So those are things to kind of pay attention to as well.
So you wouldn't notice that in a younger age, not the marijuana part, but you wouldn't notice that child in a younger age that hey, something's wrong with my child. I need to get him somewhere diagnosed about something. You wouldn't notice that then, or you wait till they're older and see.
Oh no, a lot of times, I mean, well, it just depends, right? Some symptoms present themselves earlier in life, and some
Okay,
diagnoses or disorders kind of appear later in life. But I think you notice when your child is changing, and you
right,
notice when things are going on, and I think that that's when the communication part comes into play. Like you have to meet your child on their level. We can't have the same conversation with a 16-year-old that we have with our 5 or 7-year-olds. So I think you just have to meet them on their level and figure out or talk to them about what's going on in a way that they understand it.
Right, right. Okay, so you talked to us about the pandemic. You talked to us about the children with the stress and anxiety. Let's talk about the loss of a loved one during this COVID-19. Because now you're clean and everything. So dealing with the loss of a loved one and during COVID-19, and now we increase our mental illness challenges. What do you do to help a child, an adolescent, or children and family members cope with that?
Being able to kind of, like I talk about, identifying how you're feeling around it. That's the biggest thing in for me for therapy, is being able to say and verbalize and acknowledge how you're feeling. With grief, and I know you had a grief counselor on here once before, and she was talking about how with grief, there are so many different layers and so in different stages to grief. But I think being able to kind of identify and acknowledge how they're feeling, how that loss has directly impacted them, that's a start. There's just so many things during a pandemic that we're grieving, not just the loss of loved ones, but the loss of what life was like before this pandemic. I mean, there are so many different components to grief in general. So, like I said, being able to kind of identify and get the support around that.
Right. Yeah. Yeah. You do have your friends to support you and everything, but and so because I'm an open person, I and we had just had a loss in our family, so I'm an open person, but at this time it's more like somebody start talking, and then I shun away, instead of opening and saying this is this and this is that. I'm dealing with it, but I'm dealing with it on my own level. So you think that I should just keep it open, or just continue to deal with it however I can deal with it?
I mean, I think that being open to support, we all have our comfort levels of dealing with things. And for some people, they're private. Some people can reach out and get the support that they need. And which I think either way, I mean, that's just kind of how we deal with things. But having that support, and knowing that you're not in it alone, I think can be helpful. But being able to, I mean, if you're a person that doesn't necessarily like to verbalize or be open, maybe journaling kind of what's going on with you and how you're feeling can be helpful. But I definitely think that being able to have some type of means of getting those feelings out, like I said, whether it's talking to somebody, journaling, some people, they use their arts and crafts or things like that to kind of deal with things. But I think being able to express it is important.
Yeah, I'm the type of person. I'm a happy-go-lucky person. Whereas if you was dealing with it, I'm gonna make you laugh. I have some jokes that will just make you crack up. But then when you come to me with that, I'm like,
I want to talk about it.
I want to talk about it now. So, but we're dealing with it. We're dealing with it. So I don't know. I like you said, need to be a little more open with it. Instead of bogging it in and holding it back. So
right, because that comes out in other areas, right? When we hold things in, it does come out in other areas.
Right.
But we don't always have to talk about what's going on. There are other ways to express it and get it out too. And that's what I think people don't realize. It doesn't have to be a conversation. It doesn't have to be in therapy, I mean, which would be helpful, but there are other ways of self-expression or being able to get out what we're feeling.
Yeah. Okay, we're gonna get off that subject before my feelings start coming out.
Okay.
I'm just kidding. Okay, so how can I support a person or a child? Let me put a child out, just a person who has developmental disability to cope with COVID. Because now we're talking something different entirely.
Well, once again, we have to kind of get on their level and meet them on their level, right? Everybody's comprehension or understanding of things is completely different. So I think we have to get on their level and kind of see what it is they understand about what's going on, and talk to them in a way where they can interact with them in a way where they can kind of feel secure, because I think that's a lot of what's going on too, is a lot of people aren't necessarily, there's a lot of insecurity or feeling insecurity with when you talk about children, when you talk about people with developmental disorders. So being able to get on that level and just help them feel secure about what's going on and supported and loved and nurtured through this.
But do you think it's harder?
Definitely. Definitely. I mean, it's hard. Think about it when you're talking about your children that don't have developmental disorders. It's definitely harder to as adults to kind of understand from their perspective, right? So yeah, I
Mhm.
definitely think it's harder. But as much as possible, that goes back to trying to have that structure and that routine, because most people thrive off of that. Most children thrive off of that. Most people with developmental disorders, they thrive off of that. So being able to have structure, routine, the support, the love, the encouragement, all of those things are important
Yeah.
more now than ever.
Right, right. So we really need to like clean more to the our children with the developmental disorder or what?
I think being supportive, because some don't like the clinkiness, right? It depends on your child and knowing how they thrive best and knowing how they feel secure and loved best. So whatever that is for them, being able to provide that for them.
Oh, okay.
But we have to take care of ourselves in order to be able to do that too, right? So
Right.
that goes back to us and engaging in that self-care so that we can be present and show up for the people that are counting on us or dependent on us.
So mostly everything that we do, it goes all the way back to self-care, right?
A lot of it, yeah. I think
Yeah,
that's definitely an important, just like how we talked about that phone charger, right? And
right.
how we're not gonna let, we will go stop off and buy a charger if we don't have a charger with us before we let that battery go dead. And that's
Hmm.
kind of the same thing with us. Like we have to take care of ourselves more now than ever with everything that's going on in the world. And I think a lot of people feel like they don't have they look at self-care as a luxury. And
Right,
it's not necessarily a luxury, it's a necessity.
right, right. Exactly. And that's what's hard for people. That's hard. You know, a lot of people don't know about how to do self-care. You know, when you speak of self-care, they think of different things like, oh, makeup, uh you
Yeah, you're right.
know what I mean? Cleanliness, of course you need to be clean at all times, but they don't understand self-care. And
Right.
I know
So,
it earlier, but there are some people who wasn't on here. So can we kind of touch it a little bit?
mhm,
Okay.
self-care is what we do, that something that we do that refreshes and re-energizes or recharges us. It's pretty much like we talked about, being able to, or not being able, finding something that we like to do that makes us feel good. And like we talked about before, it can range from a variety of things. For some people, exercise is what they consider their self-care. Um, being able to go for a walk, or putting together a puzzle. I mean,
Right.
it could be something as simple as those things that are considered our self-care. So, and those things are important, for us on a day-to-day basis. So even if that's you just taking 5 or 10 minutes to do something, that's important for you. So being able to carve out some space for you to do something that you enjoy and that refreshes and recharges you with self-care.
Okay. 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 So we talked about all that. All that sounds good. I'm glad because I'm learning some stuff myself. About the COVID-19 and how we should take care of ourselves and stuff like that. But now I want to ask you the big question. So, what are some questions that we should do before dating in this pandemic?
Whew, dating in this pandemic, from what I hear, it's a lot different, right?
It's a
Because
lot different.
yeah, I think that being able to have those conversations around your comfort level, because everybody has different comfort levels when it comes to this pandemic. Some people are comfortable with maybe going to eat outside at a restaurant. Some people might be comfortable with going to the park and having a socially distanced picnic. But I think being able to get information around that person's comfort level. Because eventually, you know, you're gonna want to meet up with the person, right? That's how you get to build your relationship. So you're
Right.
gonna want to meet up with the person. So being able to ask those questions like, well, you know, what's your comfort level? What is it that you're comfortable doing during this time? Are you working in the public? Are you at home doing, you know, work from home? Who lives in the house with you? Are they going out? Being able to ask those questions and getting more information just around their day-to-day life, to see if it kind of fits with what you're comfortable with or what your day-to-day life looks like.
So you saying I should? I'm not. You're not saying.
You about to date?
Huh?
Because you said I.
Wait, well, I should say anybody. I'm trying. So you think I should? Oh wait, put it back. Don't let me say I. I'm not using me as a person. So you think one should date virtually before meeting up with that person, or what?
Well, how are we meeting them? Are we meeting them in a grocery store? Did we meet them online? I mean, once again, it kind of goes back to what your comfort level is. I think that being able to discuss that and you guys deciding, you know, how you want to do it. A lot of people are doing virtual dating where they set up a time where, like how you and I are on camera, and they can have their dinner together. I have quite a few clients that, you know, that's kind of how they've been dating. Or they have Zoom is free now. I don't know if I mentioned that. So it's free during the pandemic. So sometimes people set up that where they can watch a movie together. They can, you know, eat together on camera. They can, you know, talk or whatever. So, I mean, once again, that just depends on your comfort level, of if you want to do in person or you want to continue with virtual until you both are comfortable with doing in person.
It's up to the individual.
It's up to the individual. But there are creative ways to still get to know a person and connect in the virtual world as well, like how we're doing now.
Right. So you think, do you think the mask come off before? No, do we get tested before the mask come off?
Once again, that's a personal preference, you know, whether or not you're
comfortable. We're gonna get tested now.
Whether or not you're comfortable with that. I mean, I think that's definitely up to the individual, whether or not that's something that they want to do. I just think that we all have to be safe, and we all have to kind of talk about, like I said, what our comfort levels are and what safety precautions we're taking.
Right.
It used to be back in the day where the only thing you had to talk about was, well, safety concerns was like your sexual history and things. But now you got to talk about, well, who you around, who they around, and what we doing to protect ourselves from.
And you still have to talk about that now.
Yeah, you still have to talk about that. Definitely, but the COVID.
Because shoot, don't get me started. I'm trying to be nice. Okay, so should I remain when I transition? Should I? How do we transition from virtual to outdoors?
As far as dating, or just like it all goes back to those conversations about what we're comfortable with.
How we comfortable, right?
Yeah, what we're comfortable with. Some people, like, they're okay with immediately, let's go out and do something outside. But it just depends on what your comfort level is, and making sure that you have those open conversations around that.
But you know, okay, so you know, dating and everything. Even though we in this pandemic and our mental health is very serious doing this, it's worse now. Your mental health is worse now. This is me. This is Deborah Jones talking. By when you find someone that you really, really care about, and all of a sudden you break up, and now you have this transition. Now you're alone by yourself, you know, and you don't know how to cope with it because you've always been with Joe. Now Joe gone. Now Joe is gone.
Mm-hmm.
So how do I can't deal with this because I don't know what to do. I don't know what's coming up next because Joe and I spend so much time together. So how do you think I should deal with it? Should I go ahead and call a therapist? Hey, I need you. Or what? Mm-hmm. Just sit down and what?
I mean, that's part of it too. But I think along with that, being able to, I mean, we all have support systems that we can reach out to, because like we talked about before, sometimes therapy in the Black community just isn't a thing. Right. I'm just gonna be honest, but I think we all have support.
You know who we turn to. We turn to Jesus.
Right. But I saw a shirt and I like that shirt because it said you can pray and also have therapy. You can do
Right.
both simultaneously. And I think we don't realize that. But
Right.
back to what you were saying, I think being able to reach out to your supports and get the support around what's going on with you, connection. I think that those are things that are important, especially when we're going through challenging times. And also you can connect with the therapist as well.
Mm-hmm. So you think that because we have this coronavirus, that dating will change forever, or what?
It possibly could. I mean, I think the way that we look at life in general will change forever because of COVID, right?
I guess.
Think about it. Think about the trauma that because we're all experiencing some form of trauma from this.
Right. Exactly.
Yeah. So I definitely think that just life in general after the pandemic is gonna be different. I mean, there might be little things that kind of get back to normal, but the way that we see a lot of things is gonna change because we've all experienced something that in our wildest imaginations we probably could have never thought about or thought of. Yeah, so definitely, I do think that there'll be some changes.
I know that educators, I know how scared they are with going to work and thinking and knowing that, okay, my person next to me, not even educators, just anybody who's going to work, the person next to me might have the virus and everything, and they still in the school knowing they have it. You know what I mean? And then all of a sudden, it's across the school now. Now you got to go out of the school. Your class have to go back home, and until the 14 days, then come back. I guess it's 14 days. I don't know. I guess, but how do you now they're trying to give educators the vaccine, but they haven't gotten it out yet for the educators. But how do you think one should feel about? Okay, even a parent should feel okay. Now my child, because they parents will get mad. Now my child went to school. Now they're coming out of school. Now they're going back. It's just
that back and forth
thing. So how do we cope with that?
Well, we have to be mindful of how we feel because our kids pick up on our feelings and emotions. So if we're showing that we're getting frustrated and all of those things, I think that affects our child and that plays out on them. So that was one of the things that I was reading when they were talking about reintroducing the kids back into school and how the parents' views about that has a direct impact on how the child will feel. Because I know some communities aren't offering virtual learning. They're just in person until something happens and then they go back. Everybody goes back to virtual. But I think we have to be mindful of kind of how we can be frustrated and upset and kind of deal with that as an adult on our own. But I think we have to try to there's a level of transparency with our children that's important, but there's also a level of protection that's important too. So I think that we have to be able to kind of manage our feelings and emotions around it so that they're not picking up on it. But you're right, that back and forth, that yo-yo with in school, out of school, in school, out of school, that does affect the kids because once again, they like structure and stability. And that does affect them, that back and forth. But like I said, we just have to have those conversations with them and try to work on our thoughts and feelings around that so that it doesn't affect them because ultimately they're the ones that's kind of having to deal with this on that level of going back and forth in school.
And not only affect the children, it affects those parents too.
It does, because then if you are a parent that works outside of work, you're right, and you have a second grader, they can't stay home by themselves and do the virtual learning. So now you have to either figure out how to have someone come in the home or go somewhere and support them, or you taking off for work. So you're right. It definitely does affect everybody in the household when it's that back and forth. But once again, it's kind of like one of those things where, being able to be present and kind of deal with what's going on and asking for support when you need the support too. That's another thing that I think a lot of people struggle with is asking for the support and saying what it is you need.
Right. And then we really some of us don't know how to ask for that support.
You're right.
Because I had once before, it takes a village to raise a child. Mm-hmm. But you can't find that village, and it's not as prevalent as it was back then. Right. But So
Well,
now,
even COVID has changed that because everybody is in their own bubble. And so it is challenging getting that support when everybody is afraid of, being connected with other people that are outside of their bubble.
right, right. Here's a question. Here's something just came up. I don't know if it's a question or a statement. Often doctors want to prescribe pills for depression and anxiety. What is the better course of treatment?
Cognitive behavioral therapy is very helpful in treating anxiety. So that's one form of treatment that can be utilized to treat anxiety. Um, and I mean, I fortunately enough, in our clinic that I work for, they're pretty conservative when it comes to prescribing medication. So we do a lot of the cognitive behavioral therapy, just a lot of different treatments before we get to that place of saying, hey, let's try this medication. So that's kind of the fortunate thing about the clinic that I work for. But yeah, that's helpful in treating anxiety. So find you a cognitive behavioral therapist and they can help you learn to manage that.
But you have children that are in school that parents who go out and get them help, um, just for the book. I'm putting it like that. And but then you watch that child is jumping all across the room and everything. I don't know, the parents don't do that before they get home, but they jump on top of the table and everything. And but you call the parent and you can't get the parent to tell, come get your child. Something's wrong. And then but she's right. You find these doctors that want to give them pills. To be honest with you, I don't believe in that. I really
So we were just talking about children when we were talking about the anxiety, or just was it a broad question?
It was this anxiety and depression. This we want to give them pills. So I don't believe in children with pills. I really don't. I mean, it might be for them to have, but then it's a drug, and then later on in life that's when they might do deal in that later. So I don't know. I just don't.
Well, I'm a firm believer in taking the least restrictive way first, right? And kind of trying to work with that. So the minimal what am I trying to say? The trying to do something that is more behavioral oriented initially than going into medications. I think that that's more helpful. And then, sometimes there are situations where medication is needed, right? But I think that when we're talking about medicating, that should be one of the last resorts that we go to, if we've tried all of these things and these things haven't worked.
Let me see
And sometimes it's hard having that conversation with people because you do get to a place where you've done all the things and that it isn't working, or there's been minimal progress. So sometimes it is hard having that conversation to say, hey, well, maybe this is the place where maybe we do need some support with the medication.
Right, right. So medication could be a plus in some areas.
Yes, I've had some clients who they're like, because they might be resistant to the medication, and we've been working together for a year or whatever, and there's been some progress, but maybe not at the level that they want. And so then we revisit the medication, and I'm talking about adults, not necessarily.
Right.
Yeah, and we revisit the whole medication thing, and then they go see the psychiatrist. They start taking the medication, and they're like, darn, I should have done this a long time ago because I do feel a lot better. And
Right.
sometimes it's just a short amount of time that a person needs to be on the medication for there to be improvement, for them to be able to actually utilize the skills that they're learning and being able to, to put those things into practice. Sometimes the medication just is there to serve that purpose. And then eventually they are able to taper off of the medication. So
Tell me something about bipolar.
What about it?
I mean, I know a lot of people a lot of bipolar people are on medications, right?
Mm-hmm.
So does that work for the person or what?
Well, when you think about bipolar disorder, most of the time there's a chemical imbalance in their brain.
Right.
And so the medication serves as to kind of help balance that chemical imbalance. So ideally, when a person truly has bipolar disorder, you can do some therapy and to be helpful, but medication, because bipolar is a lifelong disorder. That's not like depression or anxiety where you can have depression for a while and it go away completely. Bipolar disorder is something that people are going to deal with forever. So the medication is helpful in being able to manage that or balance that chemical imbalance that they have going on. So we believe in obviously medication management for it, but also behavioral treatment or cognitive behavioral therapy, or just therapy in general to kind of help them deal with the behaviors that are associated with bipolar disorder or in the emotions and feelings that are associated with bipolar disorder.
You see what someone else says. She says, I would be able to do this without I wouldn't be able to do this without my village. I guess you're talking about, we was talking about there's a village out there to help you.
Yeah. That's important, reaching out to those supports.
Out to that support system, yeah. And one person said, and some are not, and some should be. Some are not, I guess some are not on medication, and some should be on medication. Is that, I guess that's what you're saying, Willia? Yeah, I guess. So, yeah, there's a lot of people who are not on medication, and they're bipolar, and they should be. I guess that's what she's trying to say.
But yeah, there's a lot of people that self-medicate that bipolar disorder with drugs, alcohol, and that's not treating the problem. But the medication can be helpful, and I think a lot of people get discouraged because sometimes it takes a while to find the right combination of medication that works for you. So a lot of people get discouraged. I have a lot of people they're like, I'm not a test rat. Like, I don't like having to try all these different medications, but sometimes it takes a while to get that right combination. And I have people that I work with that have had bipolar disorder, and you wouldn't even be able to tell because they're able to function as a person that doesn't have it because they've done the work and they're taking their medication like they should.
Right. Okay, so give us your final point as to our viewers and audience about mental health and mental stress, anxiety, and how they should deal with it or what they should do to deal with it. Call you.
Well, I think that being able to know when you're kind of at that place where you need the support is important. And support looks a lot of different ways for different people, like we've talked about. It could be just having the support of loved ones. It could be just being open and honest with what you're feeling and how you're feeling. It could be reaching out to a mental health therapist to help you to kind of learn how to cope and deal with what's going on with you. I think that being able to develop healthy self-care is important, doing things that recharge and refresh you so that you're able to continue to do what you need to do in your day-to-day life. I think that's important as well. Just being able to be kind to yourself. I think that's one of the things that a lot of people struggle with. Life right now is completely different for most people, and most people to some degree have a little bit of anxiety about what's going on in life, a little bit of anxiety about what's going on as far as the political world or politics. I mean, the pandemic, there are so many things that are going on at Ms. Deborah. Okay, there are so many things that are going on at one time. And I think that, being able to be kind to yourself and knowing that, right now, this is the way that things are. This doesn't mean that this is always the way that things are going to be, but being able to just be patient and kind with you.
All right.
Hi guys. Apparently, Miss Deborah was having some trouble with her internet connection. I have her on my phone, so I guess we can kind of finish up here.
Hey guys. I appreciate you guys hanging out with us tonight. This is Debbie Jones with Blue Table Talk, and you know that if I can help somebody as I pass along the way, then I know that my living is not in vain. So we're going to have to take this up another time. LaShawn was awesome. I really appreciate it. Remember, she's from Atlanta, Georgia, and so she just said that, you know, we said we can't connect with her, but she does know someone that that we can connect to. So you guys have a safe trip. Don't forget to take your COVID testing. And if you can take the vaccine, do that. People over 65. Love you guys. God bless. Bye.
Bye.